Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
Welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com, we're glad that you all could be with us. Also tuning in to our online affiliates around the world, we're glad you all could be with us as well. Well, there's been a lot of talk, of course, and rightly so, about COVID-19 and the impact it's having on our community. And that means, of course, a lot of people have been making sure they're getting their vaccinations and their boosters. However, it also brings up the point that there's more important than ever now than to make sure that we're taking care of all of our routine health care needs. Joining us to talk to us about how we can prepare for what a lot of people, especially here in the South, are not always looking forward to, and that's flu season. We're excited to welcome Sandra Leal to our program today. Sandra's the Vice President of Pharmacy Practice Innovation and Advocacy for CVS Health. She's going to give you guys some practical tips that all of us can be able to use. Sandra, thanks you so much for the time. Really appreciate it.
Oh, thank you for the invitation.
So, Sandra, as I mentioned, of course, in the news, a lot of people are hearing about, the COVID-19 vaccine and the boosters, but why is it so important for us to make sure we're getting our flu shot as well?
Well, we definitely want to have people protect themselves and their family from getting the flu. And we know that there are different circulating strains out there of the flu from year to year, so it's really important to get the latest vaccine formulation to provide the optimal protection. And the flu vaccine takes about 2 weeks to build immunity in your body, so it's really important to get that vaccination early in the fall, ideally by the end of October, just so that you're protected before you actually start seeing the spread in your community. And like you mentioned earlier, with so much COVID around, we've had a lot of strain on our healthcare resources, so it's really important to minimize, you getting sick and really protecting those healthcare resources for those that really need it.
We hear about, of course, the side effects, Sandra, that have been reported for some with the COVID vaccine. When we're talking about the flu vaccine, what are some of the common side effects there?
Some of the common side effects people experience can include things like soreness or redness right around the site of injection. You can also feel a little bit of muscle aches or fatigue or headache, but a lot of times these are very mild, and they tend to resolve within a day or two. And some people don't even experience any side effects at all, so it just depends on the individual.
Well, I think most of us now are really focused on community responsibilities, Sandra. So can you share some additional tips on how we can protect not just ourselves and our family, but also those around us that we meet?
Yeah, absolutely. I think one of the best practices is to wash your hands throughout the day. When you're touching door handles and other surfaces, it can happen very easily, that spread. So it's really important to wash your hands, and really especially after coughing and sneezing. The other key thing is really avoid touching your mouth, your eyes, and your nose so you don't have that spread. But just some other practices include, just getting really healthy habits in mind. Plenty of sleep, managing your stress, drinking plenty of fluids. All of those will really help your immune system during the flu season. And then the one other thing that I highly recommend is limit your contact, especially if you are sick. I think that's one of the most key recommendations. Just try to avoid spreading it to others and just protect yourself and your family by limiting contact just during that time that you're not feeling well.
With anything health-related, unfortunately, Sandra, everything's become full of conspiracy and people have their own thoughts about things. What are some of the most common misconceptions around the flu? I mean, we've heard it again with COVID, and I keep bringing up COVID because, of course, that's been something all of us have been dealing with, but, we kind of forget about these other things like the flu and flu season. But what are some of the common misconceptions around the flu?
I think probably the number one myth I hear is that the flu shot itself will give you the flu. And flu shots are made with a killed virus or an inactive virus, and so it does not cause the flu itself. Like I mentioned earlier with the side effects, you could have some of those side effects, feeling a little tired and fatigued, but it itself does not cause the flu. So that's just one of the number one misconceptions. The other thing I hear a lot is that you should wait until flu season peaks to get your vaccine, and it's actually very important to try to get that flu vaccine a little bit earlier in September and October, just because it takes 2 weeks for your body to build immune protection after the vaccine, and it's ideal to have it before you start seeing other people get sick. And then the last myth that I hear a lot is that if you get the flu, that you don't need to get that that vaccine just because you've already had the flu. But really, there are different strains of flu circulating out there. So just because you've had the flu doesn't mean you can't get it again. It's really important to protect yourself from the different variants, the different strains, by getting that flu shot every year.
Very good information and timely for us, Sandra. We're so glad you could join us again, everyone. Sandra Leal has been our guest, the Vice President of Pharmacy Practice, Innovation, and Advocacy for CVS Health, helping you guys understand the importance of getting the flu vaccine. So, Sandra, where can our audience go for more information?
Yep, they could definitely go to any CVS pharmacy or Minute Clinic. We have a lot of locations, over 9,000 locations. We have evening hours, weekend hours, and we're trying to make sure this is convenient for people to be able to obtain their flu vaccine. We have different websites. We have cvs.com, minuteclinic.com, and we also have a CVS app on your telephone, or you can also text the word flu to 287-898 to schedule your vaccine. So we've tried to make it really convenient for people to access information and to schedule the vaccine.
Sandra, thank you again for the time and the great work you're doing, and looking forward to speaking with you again.
Sounds good. Thank you so much, and stay well.
Hey, thank you. Same to you. And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Let's go make today amazing. Take care.